My name is Catalina Gallo, and this is my presentation on the information systems life cycle and process. The process an organization goes through in planning, selecting, implementing, and evaluating a healthcare information system is called the Systems Development Life Cycle, SDLC for short. It is used to model or provide framework for technical and non-technical activities. It delivers quality system that meets or exceeds business expectations. It also helps healthcare organizations have better decision making in the system that is chosen and implemented. The SDLC helps to ensure that the electronic medical record software that is chosen is cost effective and is the best software for the HCO. It also helps to ensure that the project is completed within time. Most healthcare organizations follow 4 steps for choosing and implementing a new computer-based system. The steps include planning and analysis, design, implementation, and support and evaluation. Computers and medical software are becoming even more integrated in the daily business of healthcare companies. Healthcare organizations are becoming more dependent on computers as they manage business data and assist or track workflow. It has become increasingly apparent that poor design or failure of software can be costly in terms of lost productivity. Poorly designed software can increase security risk and decrease data integrity. SDLC can help to prevent this. SDLC models plays an extremely important role in electronic health record system implementation. If the staff and physicians know the system very well and understand it, the greater the chances of success. Even though switching to electronic health records or upgrading to a new system can be complicated and complex process, the SDLC helps to put the chaos in order. There are some factors that must be taken into account to have success in the system development lifecycle. First, the secure management support. The management and committee in charge of the implementation of the software needs to be always in contact with the developers and provide help in anything they need for them to provide the best top-level product for the healthcare organization based on the needs and budgets. The healthcare organization needs to take advantage of the technical and business expertise that comes with the software. Electronic health records implementation requires a great deal of expertise, so any suggestions by the developers should be welcome. The staff should take advantage of the IT company to ask any questions and to make any changes that might be needed. The operating committee should tell the developers which are the most important parts of the software so that if any issues arise, the developers fix those first and make decisions based on importance. There should be well-defined procedures and everyone should have a clear understanding of the goals at each phase of the cycle and the methods for implementing each goal. It is important to document everything that is done in the implementation so that the product succeeds in its life cycle. This is just a little picture that shows the systems development life cycle, the planning, analysis, the design, coding and testing. Coding is done more for when it is developed specifically for someone, the testing and the maintenance. Planning, analysis, and design make up the system acquisitions process. The system acquisition process has various steps within itself, such as establishing a project steering committee, appointing a project manager, determining the system goals, evaluating vendor proposals, conducting cost-benefit analysis. Here you can see all of the system acquisition process. It is important to examine the current system and problems in order to identify opportunities for improvement. The first step is planning and analysis. In this step, management identifies whether or not they need a new system or they need to upgrade. Most likely they will if they are part of the meaningful use providers. When it is clear that the system is needed for the next step is to assess the needs of the users and what requirements are needed. Questions such as how many users does the healthcare organization have? Do we need to have an interface with different labs? Does the system automatically upload vaccine records into states' vaccine records? These are important questions. The purpose of this step is to find out the scope of the problem, if there is any, and determine solutions. This first step can be very time-consuming since the needs of the project need to be identified and the project manager needs to generate a proposal. The proposal will be done once information is gathered, organized, and evaluated to know what is needed to operate smoothly. A project steering committee should be made to define the project goals and help in anything that is needed. Project steering committee determines what is needed, such as resources, cost, time frame, staffing, benefits, determines system requirements. There are some important questions that should also be asked before the project is started, such as, will the product fulfill the identified need? Is the improvement worth the cost? What are the limits of the project? And what are the consequences to the healthcare organization if the project is not approved? The design step is next. This step starts when the HCO knows what is needed. Management and project committee considers all of its options. Options include building a software from the ground up, just for the company, buying a system already made and tweaking it to the healthcare organization needs, or just upgrading system being used now. Management requests proposals from different vendors. This step reveals whatever flaws there was in the first step that requires changes. Design changes are done, such as incorporating workflows into the design product by setting interface controls and modifying vendor products to fit the healthcare organization needs. Before the system goes into the implementation stage, pilot testing is done, which includes system response tests, running reliability tests, and running the software through different scenarios to see what happens and what needs to be changed or altered. The third step is system implementation, which begins once the healthcare organization has acquired the system it wants. This step includes the go-live date, which is when the new system goes online. During implementation, there should be an implementation team, which includes physician, nurse manager, lab manager, radiology director, IT department, business manager, and anyone else who is important. There should be one person assigned for all the questions. For example, in my old job, I was the go-to for all questions because I figured out how to work the system very early on. So people would come to me instead of calling the IT support. Sorry. Other activities that should occur include determining the project scope and expectations, establishing and instituting a project plan. During this stage, other events happen, such as configuring the software to user and providing more than enough training to the staff and providers. The data migration between the old and new system has to happen, and the chart abstraction is completed. The new software is installed during off hours, and the old system will not be removed until everything is working perfectly within the new system. The last step is support and evaluation. This step is very important to determine if there are any issues with the system. Staff members should communicate and let management know if there are any changes that can be done to make it easier for everyone. Providers also need to let management know if there is anything that needs to be changed, eliminated, or added. Any issue that occurs needs to be documented and talked to with software support or vendor to be changed then or to be included for future updates. It is important to always maintain and regularly update the software to ensure reliability. With updates, functionality is improved. Since there are updates, there should always be training going on. Information systems have a life cycle. This means the system will eventually need to be replaced or updated again. Electronic health records can improve the quality, cost, and patient satisfaction of a healthcare organization. It is proven that electronic medical records improves the quality and efficiency of healthcare organizations. To start off, if quality, cost, and patient satisfaction want to be measured, a team of staff members must be appointed to gather and evaluate the information required. Quality can be measured by running reports on specific diagnoses, incident reports filed by staff, procedures done in the organization, readmissions, etc. Impact on cost can be measured by comparing balance sheets and income statements from previous quarterly reports and previous years to determine if more money is being used before or after the electronic health record implementation. Determine what changes can be done to continue saving money. The impact on patient satisfaction can be determined by asking patients if they want to participate in surveys and remain anonymous when they are being discharged. Surveys can also be sent to the home or by email. Follow-up calls can occur. Here in Miami, when you go to Baptist Health Hospital, when you have been in their emergency room or admitted, they call you afterwards to see how the patient is doing. Management can also see how the hospital is being reviewed on different social medias, such as Facebook, Google Reviews, and Yelp. Insurances also have HCO ratings on their websites, and some are assigned as top providers in the area. Providers with access to complete and accurate information provide better medical care than providers who do not have that type of access. Electronic health records improve the ability to diagnose and reduce medical errors and improve patient outcomes. A survey done by the government reported that 94% of providers report that their electronic health record makes records readily available at point of care. 88% reported that their electronic health records produces clinical benefits for the practice, and 75% of providers reported that it allows them to deliver better patient care. Medical records reduces errors such as when a patient has an allergy. The electronic health record can automatically check for problems with the medication assigned and can show an alert to the doctor if the patient is allergic to that medication. Electronic medical records can also expose potential safety problems and avoid serious consequences, such as medication interaction with other medication that is sent by another provider. In a paper-based setting, it would take years to fix an operational problems, and with electronic health records, it could be fixed quickly. With electronic health records, it is so easy to track what a staff member does that if there was an issue, it can automatically go get checked to see who caused the issue and be reprimanded depending on what happens. At the beginning, EMR implementation can seem expensive, but over the years it could actually reduce costs. Electronic health records implementation can be evaluated by determining how much money was spent on actual software, electronics, implementation, staffing, IT solutions, and other items. Time spent in training, scanning the paper charts to electronic medical records. Management also has to evaluate how many patients are seen a day when the change happened from paper to electronic medical records. Does electronic health records cause shorter or longer visits with the patient? Does this cause a decrease in insurance billing or in how much are being paid by how long the patient is with the doctors? Electronic medical records costs can also be evaluated if there were cut downs on costs such as paper, toner, prescription pads, x-rays, results, lab printed, less overtime. Electronic medical records helps with the control of medication and vaccines given, which in turn helps to save costs and spend less money because of systems that track medication given and expiration dates. Electronic health records also track what products are in the organization, how much of them are being ordered, and if more need to be ordered or less. Electronic health records also allow for the tracking of how many procedures were done with various machines, which in turn can let management know if they need more machines, such as MRI machines, or less machines in a specific department. Electronic health records definitely increases patient satisfaction. Electronic health records offers better health care. It reduces the amount of time a patient has to wait at a doctor's office, and it improves appointment scheduling. It also helps to eliminate unnecessary tests and immunizations that could have been done already by another provider. It helps to give patients quick and easy access to their health records, which in return can encourage them to be more active in their health care. Services such as e-prescriptions and home mail pharmacy can increase efficiency and patient experience. Electronic medical records can also increase patient engagement. I don't know about you guys, but for me, knowing that I can see all my things online helps me track my health a lot better. And it is easier to go to different doctors instead of taking all of my health records. They can be transferred from one doctor to another, especially if they work in the same hospitals. I hope my presentation gave you guys knowledge and how a systems development life cycle works, and how we can do a plan to be able to determine how the electronic health records has affected our quality, our data quality, our patient satisfaction, and our cost. Thank you.